Over the last 35 years, Bob, myself, and Mike have worked with thousands of patients with knee pain originating from arthritis. It's a very common problem. And Mike, can you talk a little bit more about it? My knee hurts.
So from our common experiences working with this clientele, as well as looking at different scientific studies on the subject, we're going to talk about how you can help decrease this pain you are having without taking medication.
That's right. And this time we actually have a product that I think is very unique and very helpful that's going to change some people's lives.
Bob and Brad, the two most famous physical therapists on the internet.
Hello, I'm Brad.
I'm Mike, and behind the scenes we have Bob, and together we are the most famous physical therapy team on the internet.
In our opinion, of course. Whoa, be careful, Mike.
And if you're new to our channel and like this video, please subscribe. We appreciate it.
That's right. Subscribe because we really need some subscribers. Just kidding. Anyways, let's go on. We want to talk about some of the basic techniques of managing your knee pain, and luckily it's simple.
Yes.
But there's a little caveat, and that's cold or heat. What is going to work and how to apply it. As therapists, we've had all the years of experience, and we're going to show you the answers.
Now, looking at different studies, you can find one that back heat, and you can find other ones that back cold. So there's no right or wrong answer here. We'll kind of give you some general guidelines of when to try heat or cold, but it is definitely a personal thing for you. Experiment with both and see what feels better.
There you go. So the first guideline is if it's swollen, if it's tender, chances are you're going to work with cold, okay? Because we need to cool it down and reduce that swelling, and that also takes the pain away in most cases. So
you're having some sort of inflammatory response. That is why we want cold to settle it down. However, if it is just very stiff, the muscles around it feel stiff, they're not moving well, and it kind of achy, oftentimes heat can be a good option to try instead.
Right. So we're going to show you the options on how you can do either or.
First, we want to talk about those stiff, achy knees that need some heat, and we have lots of options you can try. The first one is simply get a sock and fill it with some rice. Make sure it is uncooked rice. I don't care if it's brown or white. I don't know if wild rice works well. But heat it up in the microwave. You can try from 30 seconds to 2 minutes. A lot of it depends upon the power and strength of your microwave and what you can tolerate for heat. But start on the conservative side of less time. And then you can place it around your knee or the muscle area you need that is being problematic.
Right. The advantage of using a rice pack is it's very cheap. You don't have to go out and buy something or order it. The other advantage is it conforms around the knee very well. All the little bumps around the kneecap, etc. It conforms very well. You can maybe have two of them to do here and here, one on the bottom, and that works very well, and it cools down is one of the disadvantages of it. But again, cost and conformity, really nice option.
Another option is something you would have to purchase as some sort of gel pack. Just make sure if it is a ice one, it is also a hot option one. Some of them are just purely freezer gel packs. Do not microwave those. So make sure to read the instructions that come with it. They will tell you what time you want to microwave them for. And then these also conform nicely to your body. Some of them come with elastic straps. If it is too warm on your skin, what you can do is either wear some pants or pajama pants that are thicker, or put a towel or pillowcase. Do not normally put those directly on your skin. They may be too warm, and they could possibly burn you, especially if you have poor sensation in your knees.
Right, fragile skin, etc. So again, with this, now I would recommend, regardless of what device you're using, actually a recliner can work really well. Flip up the seat and go back a little bit so that your knee goes higher than your heart if possible. But while you're putting it on, simply this, you can use, oftentimes they come with an elastic strap, and that can help so that you get good contact, and that feels good. A little pressure around it with the heat is very comfortable, and it makes you even relax more. So again, that 15 to 20 minutes, this will actually cool down afterwards. It won't be effective anyways, and then you take it off and you'll be much more relaxed.
Now, if you're someone that tries these out and you find heat very beneficial, but you want something that can stay on your knee a little longer while you get up and move around throughout your house, that you don't have to constantly take off, something like a heated knee brace is a good option. And we actually just started making one.
Right. This has really got some nice options. Again, if you plan on using a heat pack on your knee for more than just a few days, say it's a chronic situation, you know you've been using heat successfully, this has got big advantages. Number one, all the advantages of the elastic, the Velcro that I mentioned with the previous item. There we go. So it fits on very nicely. It heats up 5 different temperature options. Is that right, Mike?
Yeah, 5 different options. You just set it with the pad on there, which is rechargeable.
Right.
You just take that off, plug it in with the USB-C to recharge it. So the heat is going to stay constant the whole time with any type of electronic heating pad device in comparison to gel or rice, which are going to cool down over time.
Right. And then the other big thing, let's say you're in your recliner and it's like, you can hear the stove going. You got to turn the rice off because you're making for supper. You can get up and move around easily with this, regardless if you're going into the kitchen or the restroom or whatever it may be. Keeping the knee warm. 5 different temperature choices. It's just a wonderful device. I'm very happy with it. I did a lot of research on assessing the temperature of it, where the temperature elements are, and it gives A+ for me.
Yeah, it's very handy. I would say it's not like a knee brace you're going to wear all day long, that like a typical one, but it's very handy if you're looking for that heat option and being able to move around more freely.
There you go.
And
the
that just
yeah.
slides right on and off. You just long hold it to turn it on, and it's 2 other buttons. It's pretty simple to use.
There you go. We got time, options for time, so it turns off automatically. I don't know if we mentioned that, Mike.
Now we should talk about the other option, which is cold. Now we're going to talk about some options for cold. Now, obviously, if you have access to a cold plunge.
But wait, Mike, I think we missed something.
What?
Why would we use cold just by looking at it? Because it's tender, it's swollen, and it just is very sore. Putting hot heat on it may make it worse because the inflammation is going to make the swelling grow, actually.
Yes, so ice is a good option. Then, so again, like I said, if you have some option of, you could take a cold ice bath if you want, or the cold plunge, which is really popular. If you really want to, you don't have to.
Mike, come on.
But it's an option. But some other options are, again, you could take the rice pack and freeze it. It'll work just fine that way too. I wouldn't keep microwaving and freezing it alternatively. I would just pick one or the other, but you can.
Right. Again, the same situation. It's cheap. It works well. It conforms well. The downfall, again, it's limited as far as how long it's going to stay cold.
You could certainly just take ice out of the freezer and put it in a Ziploc bag as well. However, if you have cube shapes to them, they often don't conform to your body as well as a rice pack, or again, a hot cold gel pack or just a cold gel pack work really well. You also may want to put a layer of insulation in between you and the pack if need be. Again, you can just wear pants that are thicker or use a towel, pillowcase, whatever you have available. Typically with these, obviously they're going to cool down, but normally we recommend like 20 minutes. You can wear it for and then take it off. Obviously, it's just going to naturally cool down, so if you leave it on longer than that, it's not really going to have any negative effects. If your cold pack doesn't have a nice strap, you could certainly take some sort of A-strap like Brad is doing now and just wrap it around there to keep it on there tighter.
Just make sure, do not make it real tight. Just a comfortable fit so you have contact. We're not trying to squish it real hard. You could actually tourniquet or reduce circulation. Not what you're looking for. The other thing that if you don't want to buy a gel pack, you can make your own gel pack with rubbing alcohol and water. If you just look up on YouTube, Bob and Brad, how to make your own cold pack, we give specific instructions. You just need 2 Ziploc freezer bags, 1 cup of rubbing alcohol, 4 cups of water, and they do work. I would say they work as well as these. As long as you got the mixture right. Keep them in. I don't have one in my freezer right now, but oftentimes I do. My parents, when they were alive, I had them made for them because they needed a cold pack every now and then. It's a good, cheap option.
One other option that we did not bring here to the studio today, but is any type of frozen vegetables. You can often take them out. They conform to your body pretty nice as long as the bag isn't too worn out. I would not buy something like a broccoli cauliflower mix because it's kind of chunky and thick, but maybe, you know, the peas or the corn or the little carrots, those would be better options.
Yeah, you know, I've always given that option to patients, but I didn't endorse it real strongly because, you know, if they're froze together and you got clumps and you got to break them up, and, you know, then there's a question, do you eat the food after
it unthaws so much it's going to smell a little bit, but hey, if you're in a pinch and you only need it a couple times, that's definitely an option you can try.
Yep, there you go. It's certainly something that's been used successfully, I might add.
Now, this video does not show stretches and exercises for arthritic knees, but if you want a video that does show some gentle stretching, you can click the video link on the screen.
Right, because range of motion with arthritis is absolutely a key. They call motion is lotion. In other words, you keep the joint moving with gentle motion. Even when it's sore, it's going to help things out, get that synovial fluid moving along. But wait, we've got another video, right?
That's what I just said.
Oh, yeah.
3 gentle stretches to reduce knee pain. There it is on the screen.
But if you Google Bob and Brad, we actually have other videos as well, you know.
Yeah,
you don't have to
just
watch
a
that
few.
one. Yeah. Anyways, we're going to go chill out. Get it?
I'm going to heat up.
Bob and Brad, the two most famous physical